Prior authorization with Medicare Advantage plans. That's what I want to talk about in today's video. My name is Jamie from meetjamie.com. I'm an independent insurance agent. I help people all over the country understand the Medicare program and find the coverage that fits their needs. So there's a lot of buzz right now on the internet and in the news about prior authorization, specifically with Medicare Advantage. And I've watched a lot of it, I've read a lot of it, and I've listened to a lot of it. And quite honestly, it's pretty scary when you start to dig into the topic. However, this report that I'm going to share with you today sheds a different light, and it shows that maybe the headlines that are being thrown around on the internet talking about the dangers of prior authorization might be just a little bit exaggerated. And here's the reason why. So, according to an analysis that was done in 2021, it found that Medicare Advantage plans denied 2 million prior authorization requests, and this was in 2021. You think, wow, that's a big number. But in actuality, it was only 6% of such results. As you can see here on the screen, there was 35 million requests submitted on behalf of enrollees that year. So yes, there is prior authorization required on some services with Medicare Advantage plans, and those things do happen, but I'm not sure it happens as much as you might be being led to believe based upon the internet and the news. Again, in 2021, 6% of those prior authorization requests were denied. So 35 million were made, 2 million were denied, which is about 6%. So the purpose of prior authorization is, you can see here in this short article, is to ensure that the healthcare services that a patient is receiving is medically necessary by requiring providers to obtain approval before a service or other benefit is covered. Prior authorization has long been used to contain spending and prevent people from receiving unnecessary or low-value services. However, there are some people who are raising concerns that it's creating barriers to receiving necessary care. So there is a debate happening right now, even in Congress, about prior authorization, and there's some changes that are coming even in the next year or two around this to help make sure that Medicare Advantage patients are receiving the care they need. But I want to show you something else that I found really interesting as I was reading this. So only about 11% of denials of prior authorization requests were appealed. So in other words, there was a prior authorization request sent in, it was denied. Only about 11% of those were actually appealed. So that's interesting. So there's a lot of people who could have made an appeal who didn't. And it goes on to say, of the appeals that were filed, the vast majority, 82%, resulted in fully or partially overturning the initial denial. Now, there's no question that this would be a frustrating process as a patient. There's no denying that. But there are systems in place so that you, as a Medicare Advantage patient, if you apply for an authorization and it's denied, you can appeal that. So the article goes on to say the high rate of successful appeals raises questions. Again, there's some scrutiny being made around this, whether a larger share of the initial prior authorization requests should have been improved. And then it just goes on to say that there needs to be improvement about these policies and the effect that it has on Medicare beneficiaries. So I wanted to just share that quick video today because sometimes when you hear prior authorization denial, Medicare Advantage, you can be led to believe that it's a very regular occurrence, But this particular analysis in 2021 found that actually it was about 6%. So if you'd like to read this article, I'll put a link to it in the description of this video. If you like videos like this, please subscribe to the channel, hit the like button, and if you have questions about Medicare, feel free to leave me a comment or reach out to me toll free or through my website. I'll leave that in the description of the video as well. Thanks for watching. Have a great day.